Hi, I'm Sue Lana. I'm the Clinical Oncology Service Chief here at the CSU Flint Animal Cancer Center. Thanks for your interest in our specialty training programs. This year, due to COVID, we won't be able to have you come visit. So the purpose of this video is to give you an idea about our comprehensive cancer programs, to give you a tour of our facility, and to answer some of your questions that you might have about our specialty training programs. So let's mask up and get going. One of the unique things about our training programs here at CSU within the Flint Animal Cancer Center is the comprehensive nature of our clinical service. And by that, I mean we run a multimodality service, which entails having radiation oncology, surgical oncology, and medical oncology all receiving cases under the same service umbrella every day. So we round together twice a day, we interact with each other's cases every day. When a client comes in to see us and brings their patient, they'll get an evaluation by a primary clinician, which could be from any of those services, and then they get additional evaluation by a radiation oncologist and a surgeon, all in one visit. It allows us to give our patients a higher level of care or a more streamlined level of care, all at the same time. Another advantage from a training standpoint is as a medical oncology resident, you then get exposed to radiation oncology and surgical oncology every day. And from a surgeon standpoint, you get to interact with chemotherapy patients and see what the pros and cons of those protocols are. And the same is true for radiation therapy. We all get to see a little bit about each of the specialties. And so it's a big advantage, I think, for the trainees.
I'm Brandon Janssens. I'm an assistant professor of surgical oncology here at Colorado State University, Flint Animal Cancer Center. The Surgical Oncology Fellowship here is one of 3 active programs in the United States at the moment. The program at CSU is the oldest and most established. The first fellow matriculated the program in 1988, so almost 35 years ago. The program here is a robust, immersive training program, which is mostly clinical. The fellows will spend 53 weeks here. 42 weeks of that is on the clinic floor, and then the remainder is either sitting and taking the ACVS board exam or for research. The program itself is accredited and overseen by the ACVS Fellowship Committee. At the end of the program, once the credentials are met, you will be eligible for fellow status in surgical oncology via the ACVS. The clinical caseload here has sufficient volume and complexity to meet the requirements, but we're an extremely busy service. We do on average 9 to 15 surgeries per week, and the service itself sees about 3,000 new cases a year. There are plenty of opportunities for learning during the year or training. There's no formal didactic lectures, but there are plenty of seminars and journal clubs and opportunities to sit down in a small group teaching environment. We also, as faculty, meet with the fellows once a month to discuss surgical oncology topics, present research, etc. And that provides a lot of opportunity for feedback and also for direct one-on-one teaching. Something unique about the cancer service here at CSU is that we are a comprehensive unit that is fully integrated, meaning that we see cases together, medical, radiation, and surgical oncology. No case is assigned to one subspecialty. We all contribute and take care of the cases that come into the oncology service. This allows for a lot of cross-training for the surgical oncology fellow. They will get a lot of one-on-one discussions with radiation and medical oncology, and that's fairly unique for this program. From a research perspective, there are plenty of opportunities within the center for research, either benchtop or clinical. The ACVS requirements to graduate as a fellow is a submitted manuscript to a peer-reviewed journal or to the VSSO website. And the Surgeonc faculty will be on hand to direct and mentor you through that. So as you know, CSU is located in northern Colorado in Fort Collins. There's plenty of opportunities around town to get out and about, running, hiking, biking. There's plenty of lakes and reservoirs around, microbreweries. This part of Colorado offers the fellow plenty of opportunity for a good work-life balance. Welcome to the Flint Animal Cancer Center at Colorado State University.
I'm really excited to show you the Lucy Oncology Clinic today. This is a brand new state-of-the-art space that was recently remodeled. It's really exciting for us because as a big team with medical oncologists, radiation oncologists, and surgical oncologists, we really need space that can hold us all so we can provide the best training opportunities and care for our patients.
We enjoy working in multiple procedure and exam rooms, along with a patient evaluation room, known around here as the pit, where more than one patient can be examined simultaneously by various oncology team members. Just off the pit, there's a quiet intake room set up for those patients who need a private space for evaluation. We have 2 rounds rooms, one for the whole team, where we gather twice daily in normal times. Most people participate remotely at this time, but this rounds room still serves as a workspace for our veterinary students on rotation. We also have a rounds room in the radiation oncology portion of the Lucy Oncology space that doubles as a treatment planning room. This space bears the name of a special Labrador we treated named Riley. With an eye towards improving diagnostics and treatment options for cancer patients through research, clinical trials play a critical role in not only helping our companion animals, but translating successful therapies to help people. We have a dedicated space where patients are evaluated and treatments given. Medical oncology residents and the oncology intern all rotate through this clinical trials service. Thanks to our dedicated chemotherapy room, patients receive their treatments in a quiet and dedicated space, so they're comfortable and safe. It's also a great space for our team to manage their busy schedules. All of our specialists in training have a desk in a shared office on the 2nd floor of the FACC for quiet, uninterrupted work. In addition, we have a dedicated room within the clinical space set up as an efficient workspace for our doctors. Most use it for client calls and completing medical records. The Lucy Oncology Clinic also includes a dedicated radiation oncology area. There's a client consult room and rounds, treatment planning, and procedure rooms. There's also space for day patient housing and the control room for our linear accelerator, as well as the machine itself. Our team couldn't do what we do without the support of all the other services within the veterinary teaching hospital. Our hospital features a newly remodeled critical care unit. Emergency and inpatient services also include an intermediate care unit and an urgent care service that serves the public. The anesthesia team oversees surgical and advanced imaging procedures, as well as select radiation treatments. The VTH has 6 dedicated operating rooms and a fabulous support staff. We have a brand new CT machine capable of scanning a dog in under 60 seconds. This imaging modality is becoming a mainstay of oncology imaging and is used for radiation planning purposes as well. We also have a full suite of imaging modalities that are key to the care of our patients, including PET-CT, MRI, ultrasound, radiography, fluoroscopy, and nuclear imaging. Most of our specialists in training also participate in research. The FACC has 10 dedicated laboratories that all focus on oncology research. Our faculty include both clinician researchers and basic science experts. They stand ready to mentor budding scientists, and there are plenty of interesting research projects to propose or to participate in.
We feel lucky to get to come to work here every day, and it's a really magical place to be. So please don't hesitate to reach out if you have any questions about our program, and thanks again for your interest.